So I know yes, I know no, I know 为什么. That's about all I know. You know more English than I know Chinese. So if you want to ask a question in Chinese, I have some wonderful interpreters here. Right? As I'm speaking, if you think of a question, write it down, and I'll be glad to answer it afterwards. Okay? So my technology, come on, technology. All right, my outline today is I'm going to talk a little bit about how we educate nurses in the U.S. And I'm going to talk about, if you want to come to the U.S., how we get you into our workforce. And I'm going to talk a lot about what nursing is like if you decide to come to the U.S. What will you do? How is it different than Taiwan? And I have been in Taiwan now. This is my 25th year coming to Taiwan. And so I've been in quite a few hospitals, and I have a lot of very good colleagues. And so I think I can compare the U.S. nursing with Taiwan nursing. And I'm going to talk about the very details into how to become a nurse in the U.S. So first, I want to know how many of you have been in the U.S.? One? Only one person has ever gone to the U.S.? Who went to the U.S. already? Nobody? Nobody. Oh, you must come. Especially Florida and Disney World and New York and all those very important places. And I'm going to show you where I live. So where were you in the U.S.? Kentucky. Ah, the bluegrass state. Okay. All right. So let's talk about nursing in the U.S. a little bit. And we have about 3.1 million nurses in the U.S. And here you don't even have 1 million nurses. We are also having a shortage of nursing. And here in Taiwan, your nursing shortage is much worse than our nursing shortage, much worse. Matter of fact, I did some research a couple weeks ago, and I understand that you are a group of about 9,000 students who will graduate this year in Taiwan. And of you, I hope this is not true, but 60% will stay in nursing. 40% will leave nursing right after you graduate. And that leaves only about 5,000 nurses to go into the workforce. And of that 5,000, the Ministry of Health believes that 4,000 nurses are going to be leaving the workforce every year. 4,000 nurses quit. So that leaves only 1,000 new nurses a year entering this growing shortage. And the Ministry of Health has said that in the next 5 years, Taiwan will need 75,000 more nurses. Now, how long, if you only produce 1,000 a year, how long is that going to take to catch up? So Taiwan is in a very, very difficult position as far as the shortage. But we are in the U.S. too, and I'm going to tell you a few things about what we're doing in order to solve that problem. So in the U.S., there are about 200,000 openings for RNs. There are plenty of jobs in the U.S., and especially in the advanced practice registered nurses, the APRNs. These are nurses who have master's degrees, who are nurse practitioners, who are nurse anesthetists. They can give anesthesia. These are nurses who are midwives who can deliver babies at home. In the U.S., we believe that this is going to be over a 1/3 increase need. So we are preparing a lot of nurse practitioners now. Now, how do you get to be a nurse in the U.S. if you're a citizen of the U.S.? And this is important because if you come to the U.S., you will be working alongside these people. So it's important to know what their preparation is. The first type of nurse you will see is the 2-year nurse. It's an associate's degree after high school. So you go to high school, you graduate, you can go into a technical college. In 2 years, you can take the exam and become a nurse. And you will be prepared to care for routine patients. You're not going to be in the ICU or the OR or the ER. You're going to be in a med-surg area, routine patients. Or you're going to practice in long-term care. We have a lot of long-term care assisted living facilities in the U.S., a lot more than Taiwan has. The reason that you can't practice here is because you have no leadership coursework in your academic program in your school. If you have a 2-year degree, there's no leadership. You do not learn about research. And you do not do any community or public health. So if you want to be a public health community nurse in the U.S., you must go on to get a higher degree. Even, no. In this degree, there's not a lot of critical thinking. They're not teaching critical thinking. They're doing tests. But it's the most popular degree in the U.S. Now, why is that? It's cheap and it's fast. And you can get a job. But you can't get the job you want. The second type of nurse, how to get prepared, is those that go right from high school to college, 4 years, very similar to the bachelor's degree here. And these nurses are taught critical thinking, and they can go anywhere in nursing, anywhere. And right now, we have a goal in the U.S. 80% of all nurses should be BS prepared at least. Okay? At least. So we're encouraging nurses to go on for this degree. And you can add 2 more years and get a BSN while you're working. So an RN to BSN program with your associate degree, you go 2 years, and you can be a BSN also. Right now, we're only at 70% of all nurses in the U.S. at BSN or higher, and we're hoping to get to that higher level. All right. After your BSN, you can go on for your master's. It does require a bachelor's degree. It's 2 years intensive study. You can go part-time. And there are numerous options on what you want to master. There are numerous specialties. And I want to talk about a few of them. Now, there are other ways to get a master's. So if you have a bachelor's in nursing with 1 to 2 clinical years of experience, or you have a bachelor's in a related field and you meet the prerequisites. So my daughter obtained her degree in athletic training. And those are the people who take care of athletes and put tape around their ankles and tape on their arms and tape everywhere. And she got a scholarship from the Navy, U.S. Navy. So the Navy paid her entire tuition in college. And then she had to go into the Navy for 6 years. And so after she finished her requirements in the Navy, she was not a nurse, she was not an athletic trainer. She was actually a navigator of a destroyer, a big multi-billion-dollar ship. She drove around into the Mediterranean. I don't know how she did this because the first time she took her driver's license, she failed. But she drove a ship everywhere. Anyway, she got out of the Navy and she says, Mom, she says, I want to be a nurse. I went, really? Okay. I said, but you're not going to get a bachelor's degree. You already have that. You're going to go right into a master's degree. So we have programs, if you're not a nurse, but you have another degree, you can get into a master's degree, and it's 3 years, and you come out with a master's degree and a nursing license. So that's pretty cool. You don't have to waste four more years. Okay? And we call that a direct entry nurse. To get into a master's program, there is a minimum GPA, usually 3.0 or 3.5 or above. And the education can be online. So many programs, especially during COVID, you could go to school in California and live in Kentucky and do your clinical in Kentucky while you were taking classes in California. So we try to make a master's degree as flexible as we can. Now, what type of specialties can you go into? Well, the first is a nurse midwife. And as a master's nurse midwife, you can deliver babies all by yourself in the hospital or in the community. You do not need a physician. You only need a physician to deliver the baby if there is a problem, if there's a complication. But most women do fine. So you're just there to catch the baby, right? A master's in nursing for anesthesia, you must have critical care experience, at least 1 year of ICU experience before you go into an anesthesia program. These are the highest paid master's degrees nurses in the US. They make over $100,000 every year in the US. They actually are in the operating room providing anesthesia. Now here in Taiwan, I think you have anesthesia nurses. And what they do is provide supplies, right? They're basically a supply nurse. In the US, nurse anesthetists give the anesthesia. They decide on the anesthesia, and the doctor is only there at the beginning and the end. Oh, yeah. Because it's just giving medications and monitoring the patient, right? You don't need a doctor for that. Actually, a nurse does a lot better monitoring. Now, in very small hospitals, there may be no doctor at all, except the surgeon. So the nurse can give spinals, blocks, general anesthesia, any type of drug, tracheostomies, anything like that. It's a very good job. And we're dying, literally, for more nurse anesthetists. I've had 3 surgeries in the past 10 years. Every one has been with a nurse anesthetist. And I did fine. You can become a clinical nurse specialist, although not many programs anymore. This was my background. It's population-based. So the program is focused on a particular group of patients. In my program, I became an expert, a master of cardiac patients. So I learned all about medical patients, I learned about surgery patients. Every class was something about cardiac medicine or cardiac surgery. There are programs for neurology, endocrine, rehab, orthopedics, children, perinatal, women, elders, any population you can find a clinical nurse specialist program. A newer program in the US is called the Clinical Nurse Leader, abbreviated as CNL. Now, what we found is that there's so much research going on now in the US, nobody is putting the research into practice. Nobody's translating the research. So we needed an expert at the bedside to help us translate the research. And so a clinical nurse leader is an expert in quality improvement and nursing research translation, and also a provider at the bedside. When my daughter got her master's, she became a clinical nurse leader. You can become a nurse educator with a master's degree and teach in 2-year programs, sometimes in baccalaureate programs. You can become a nurse administrator, although most nursing administrators now have PhDs. And of course, you can become a nurse practitioner. You can be adult, child, neonatal, geriatric, family. The practice, though, is different state by state. So this is your first lesson now. Every state in the US has different rules for nursing. Every state in the US has different rules and regulations for nursing. So if you want to move from state to state, and you can do that very easy, you must know the rules for that state. So for example, in my state of New Hampshire, a nurse practitioner has a lot of autonomy. Do you know what autonomy means? No, someone tell me what autonomy means. Someone look it up on your phone. What does autonomy mean? What does autonomy mean? Someone find it really quick. I have a treat for whoever finds it. What does autonomy mean? Google it. Autonomy, A-U-T-O, auto, autonomy, yes. Yes. What does autonomy mean? Independent. Who said that? Who said that? Here you go. Catch. Good job. And you had it also, right? She had it, but in Chinese, so that was pretty good too. Independent. Now, what does that mean? That means the nurse can open up her own business. There you go. Oh, pretty good. Pretty good. Can't do over here really well. That means a nurse in my state, if you are a nurse practitioner, you can have your own office. You can have your own patients. You can charge whatever you want and have your own business of health care in my state. But if you go to another state, maybe you have to have a doctor there. So every state is different. Different regulations in every state. All right, so a nurse practitioner in the US can work with a physician. When I go to my doctor, I can see my doctor or I can see the nurse practitioner. Now, I'm already a nurse. Why do I want to see another nurse, right? I don't like the nurse practitioner. She made a mistake once. My husband goes to the same doctor, and he loves the nurse practitioner. Well, because she listens to him. Okay? Now, I don't go to a doctor to talk. I go to the doctor to tell, right? I don't need to talk to a nurse practitioner. My husband needs to talk to a nurse practitioner. So, yeah, probably. So a nurse practitioner can be in a physician's office, independent practice on their own office independently. And I know quite a few independent nurse practitioners. And the independent nurse practitioners also hire other nurse practitioners. So they have their own business. You can be a nurse practitioner in acute care, in critical care, ICU. There's a lot of nurse practitioners. Long-term care are pretty much managed now by nurse practitioner. The nurse practitioner that makes the visit to long-term care, not a physician. Not a physician. No, don't need to. It's nurse practitioner. Nurse practitioners do wellness clinics. They do outpatient clinics. They do anything that a primary care physician can do. And they do it better in most cases. In most cases. All right. So what do they do? Nurse practitioners diagnose conditions. They write prescriptions. They provide routine medications and even controlled substances like narcotics. So last year I got bit on my leg by a spider. Yeah, ow, right? Yeah, and it got infected, of course. So I knew that I needed antibiotics, right? I got an infection, I need antibiotics. And it's a Friday. Do I call my PCP, my primary care provider? No, he can't see me for 2 weeks, right? Do I go to the emergency room? Oh my God, no. No, why do I go to the emergency room? It'll take me 2 hours, it'll take me 20 hours. And I'll sit there, right? So I went to an ambulatory clinic. I walk in, within 10 minutes, the nurse practitioner saw me. I said, I got bit by a spider. It's red. It's getting worse. I need antibiotics. And she said to me, okay, I'll be right back. Came in, provided me a prescription, and within 5 minutes, I was out the door. Very quick, very appropriate, and very efficient. Very efficient. So they can do all these things. They can order lab tests. They can make referrals. They can tell you that you need to go to a different doctor. Okay? They do a lot of health counseling, and that's why my husband likes his nurse practitioner. And their responsibilities are depending on specialty. For example, my daughter works in a neonatal unit. She's a neonatal nurse. And she has nurse practitioners that she works with. The nurse practitioners can intubate. They can start IVs on babies if the nurses can't. So, and they can order drugs. And they're there all the time, whereas the doctor is not there all the time. Nurse midwives, as I said, conduct uncomplicated deliveries, and nurse anesthetists provide total anesthesia. All right, and then you're going to go on for your doctorate, I hope. I hope. I've been trying to talk to my daughter about going back to school, and we're not working too well yet, but she'll come around. We have 2 ways of having a doctorate, a PhD or a DNP. The difference between a PhD and a DNP is that a PhD is research focused. research focus. Now, when I was sitting where you were 50 years ago, 50 years, this is my 50th year as a nurse. Can you believe it? Do I look that old? No. Okay, good. Good answer. You gave me a good answer. That was a good answer. Yeah, good answer. To her. She shook her head there. I don't look that old. Okay. So when I was sitting there, I said, that is not what I want to do, be a researcher. It must be so boring, right? Yeah, see, she's shaking her head too. It is not boring. It is not boring at all. So hopefully someday you'll change your mind and say, I want to be a researcher. The other thing you can do is be a DNP. A doctorate of nursing practice is a nurse practitioner who has gone on for further knowledge in the ability to change practice. So a PhD develops new knowledge, creates new knowledge, and the DNP practices that new knowledge. DNPs are not doing research, they're translating research. Yes, translating. They're doing translational science. It took me 7 years to get a PhD. You can get a DNP in 3 years full time, or you can take 7 years, doesn't matter. Most programs you can take as long as you want, as long as you finish within 7 years. All right, so in the US, we have this triangle of education. We used to do diploma degrees. We don't do those anymore. We start here. Associates 2 years, BSN 4 years, master's another 2 years after that, and then a doctorate anywhere between 3 and 7 years. So those are the people you'll be working with if you come to the US. All right, let's talk about US nurses themselves. The median age or the average age in the US is 46 of a nurse. Now, does anybody know the average age of a nurse in Taiwan? Not you. You can't do this. Who's gonna win? Who's gonna win? Average age of a nurse in Taiwan. Who's gonna get closest? 36? No, close. 39. She got it. She got it. It's okay. I don't care if she looks it up. She's got fast fingers. 39. So the average age of nurse in the US is 39, 46, 39 in Taiwan. You have a little bit more hope than we do as far as catching up with. Your shortage is bigger, right? Yeah. So, Now, 43% of the nurses in the US are over 55. That's huge. Huge. Only 8% are under 29. So we have a real aging population in the US. We have 12.6% of men right now. We have Asians, Hispanic, African Americans. The demographic makes up over 20% of non-whites, which is, we're working on this. And 55% work in hospitals. Only 55%. What percent of Taiwan nurses work in a hospital? Where else do Taiwan nurses work? Clinics? But that's in a hospital, aren't they? Where are the clinics? Clinics are in the hospital. How many Taiwan nurses walk into a hospital every day? What percentage? 30? Oh. More. Do you know? I don't know. More. More. Not 100. I think there's some nurses out there. There's some nurses are working for doctors' offices, but I think it's probably about 95%, isn't it? More than that? No. 90%? 9 out of every 10 nurses are working in a hospital. Who said 90? Who was closest? Right here, 90. Now, where do the U.S. nurses work? And we're going to talk about that in a minute. The average salary of a nurse, I put it in NT dollars, is $84,000 a year. That's the average staff nurse, not a nurse practitioner, not an anesthetist. That's you coming over to the U.S. What are you going to make for the first year? Now, what is the average salary for a Taiwan nurse? How much? 35,000 a year? Taiwanese dollar? Oh, US dollar? 35,000? Oh, in a month. All right, so how many months? 10 months to 12 years? Oh, 35,000? Yeah, I think it's a little bit more than that. A little bit more. Yeah, I think it was somewhere between 40 and 50. Yeah, yeah. This is about 3 to 4 times higher in the US. Now, we're going to talk about cost of living in a minute, but now I told you that education was different. 25% are 2-year nurses. Right now, 51% are BSN plus masters plus PhDs. Yes.
写年收入啦，所以我们要用年收入来看，不能用月薪来看。哎，你用月薪来看的话，真的台湾护理人员真的很少我相信应该是相关的单位会蛮努力的，希望能够增加一些薪水给我们护理人员，但是不知道。哎，那应该用年薪来算。今天你们如果是去找工作的话，你就直接问他们，请问年薪是多少？这样子。对，你要是 total。比如说绩效什么的，那个要算进来，那算年薪，它这个也是算年薪。通常我们比较都比较年薪如果像比较那个，国民的那个生产毛额也是用年来算，不会用月来算啊。
All right, now what about the workday of a staff nurse? What are you going to be doing? Okay, we okay? In the US, most nurses work 12 hours in a shift. 12 hours in a shift. Do you do 12-hour shifts here in Taiwan? No, right? Right, you have regulations, right. We have regulations too, but our regulations say in a week, you cannot work more than 40 hours, okay? So in a week, you can't work more than 40 hours, but you can work up to 12 hours in a day. So most nurses work 12-hour shifts. You work 3 shifts a week, okay? 3 shifts a week. So you could work Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday, Monday, Tuesday, Wednesday, no work, and Thursday, Friday, Saturday, work your 3 days in that week. You have a year, we're coming to that, yep, yep. So if you wanted to, you could almost work 2 jobs, couldn't you? And some nurses do. Or they just take vacations in between working. Okay? So in the US, they work 12-hour shifts because it gives them good work-life balance. Good work-life balance. And that's what your generation wants, is work-life balance. Now, after you get to work, you're going to get report on your patients, and you're going to do that at the bedside. So you walk around with the nurse at the bedside of the patient and get report in front of the patient. So the patient can correct you if needed. Okay? Then you're going to go out and your staff is going to meet in a huddle. You all get together and you tell each other the serious nature of some patients, so that if you're gone, I can help take care of your patient. I know that that patient is at high risk for cardiac arrest or for falls or low blood sugar or whatever. It's called a huddle. Every shift does a huddle, at least one shift. Every shift does a huddle. It's a way to communicate with the other nurses that you're working with. Just the day shift? What does the evening shift and night shift do? The day shift is always more important, right? The head nurse has to do it, right? The head nurse does not handle the huddle. All the nurses get together. There's no hierarchy. And it happens every shift, because every shift needs to know about all the patients. No, the three of us will have a huddle here. I'll go first. I'll tell you about my patients. And I'll say, do you have any serious patients? Next. Serious patients? And everybody knows about the really, yes, that's a huddle. That's a huddle. Okay? A huddle. Kind of like football, right? Like football. Every play in football, right, guys? Every play has a huddle, right? Tell you what's going on. All right, then you will do a complete assessment of all your patients, probably 4 or 5 patients, and you'll decide what's important. You'll make your day's assignment for yourself. You will give all the medications, PO and IV and IM and whatever medications there are, but your focus is going to be on 3 things: pain, education, and how can I get that patient ready for discharge? The length of stay in a hospital in the US is about 2 to 3 days. 2 to 3 days. Now, 2 to 3 days. Who can tell me the length of stay in a hospital in Taiwan? Average length of stay in a Taiwan hospital. It's Taiwan, the hospital right here. What's the average number of days a patient stays in the hospital? A week? A week? A week, do you think? Yeah, at least a week, right? So last year, when I went home from Taiwan, I had my hip replaced. I had a hip replacement, right? I have arthritis. I have a hip replacement. I went into the hospital at 8 o'clock in the morning from home. It took them an hour to get me ready for the operating room. So I went into the operating room at 10 o'clock. I was in the operating room until 12, about 2 hours to replace my hip. I was in the recovery room about an hour. So that's 1 o'clock. I went up to my room in the medical orthopedic unit. That was about an hour, and at 2 o'clock, I woke up. And I said, I want to get out of bed. And the nurse said, okay, let's go. And she got me out of bed, and I started walking with my walker. I went home the next morning. So I was in the hospital no more than 23 hours with my hip replacement. Now, how long would a patient in Taiwan be in the hospital for a hip replacement? 5 days, right? 5 days. If you come to the US, you will learn another thing, and that is every patient gets out of bed 2 hours after surgery. We call that feet to floor. Feet to floor. Why do we get people out of bed after surgery early? What is the reason that we do that? You all should know those reasons. Why? Wait a minute. Why get people out of bed? Oh, they all woke up with that, didn't they? Wait a minute. Why? Why? Someone tell me why you want to get someone out of bed after surgery. Yeah. Why? Hello. 就讲，哎，背部太大了。she said recovery early， 但是那是对的，但是你还是讲比较啊，比较快怎么样？他就刚刚讲恢复啊，一样啊，哎呀，一样啊，啊。不是，这不是马上的原因。哎，手术后啊，早期下床的原因呢？啊，看张老师，应该是避免蛮多的 complication 嘛，呀。啊。That's right. Deep vein thrombosis, right? Give that man 2 popsicles there. All right. And what's the third one? Pneumonia and deep vein thrombosis. And what's the third complication? Number 3 is pressure sores, right? Yes, yes. So we get people out of bed and we get them home sooner because we know that hospitals, even though they're clean, you can get an infection very easy, right? Very easy, kind of like MRSA infection. We don't want that to happen. So we focus on pain, we focus on medication, and we focus on discharge. What does the patient need to go home soon? They don't need to stay in the hospital, that's for sure. All right, the nurses do the treatments, do the dressing changes, change the IV, because IVs get changed every 3 days if they're still there. Nurses do the ambulation with PT, physical therapy, and they do all the feedings, the NG tube feedings. They prepare the patient for discharge, and then they admit the patient from the ER, the ICU, or the PACU. So even though you've got 4 patients, over a course of your shift, you may see 6 or 7 because you've got people going home and you've got people coming in. Got people going home and people coming in. Now, you also coordinate care. There are no special doctors in the hospital. After the surgeon operates, he goes home. The only doctor is called a hospitalist. A hospitalist. He's a generalist, and he's responsible for all the patients in the hospital. So if the nurse needs a new antibiotic or the nurse needs more pain medication, they will call the hospitalist, and the hospitalist will come up, see the patient, and order the medication. Okay? So you don't have a lot of doctors everywhere. Everywhere. You just have one doctor, which makes it much easier. We have respiratory therapists who run the ventilators in the ICU, who do the respiratory treatments. We have occupational therapists who make sure that patients can put their clothes on and can feed themselves. We have physical therapists. Before I went home after my hip, the physical therapist had to come in and watch me walk and watch me get out of bed. And she says to me, "You don't need me, do you?" I said, "No, I don't need you." And we have a social worker that helps with the billing, and we have a discharge planner if you need to go to long-term care. They make those arrangements. It's not a nurse. The nurse coordinates all these disciplines. All right, what about a long-term care nurse? A little bit different. They work 8 to 12 hours a day. They also get report in bedside, at the bedside. They also meet for a huddle, but their main job is to administer medications. They have assistants to do their vital sign data. They have assistants to do their personal care of the patients. They will do treatments if needed. They'll document progress. They'll interact with the nurse practitioner, the PA, or the provider, and they'll interact with PT, OT, and speech therapy. But they're pretty much a manager of care, not a provider of care in a long-term care facility. All right, questions up to now? Any questions? Any questions about nursing in the U.S., what it's like? I'm coming to that. I'm coming to that. I'm coming to that. I'm going to talk about money at the end, you know, that makes people interested. We got plenty of bonuses. We'll give you a bonus for just showing up someday. All right, what do you need to be a nurse in the U.S.? You need a bachelor's degree, which you're all going to have, if you don't already. You need at least 2 years of practice here. At least 2 years of practice. Is after you graduate. You need 2 years of experience after you graduate. Okay, 2 years after you graduate. Somewhere here. Okay? Because you're going to need a reference. You're going to need a reference from your boss or from your head nurse. Doesn't matter. Doesn't matter. Practice as a nurse. Practice as a nurse. Okay? You need to have a TOEFL or the other, and I'll talk about the other, what's it called? IELTS. Thank you. If you're from an English-speaking country, you obviously don't need that, but anyone from Asia is going to have a TOEFL, and I'll tell you about the limits in a minute. Then you're going to submit your transcript from the university to CGFNS. Now, this is the Council on Foreign Graduates of Nursing, which last month they changed their name. I don't know why. I don't know why. They changed their name to True Merit. So this is the website of how you are going to apply. Okay, it's no longer CGFNS. It's going to take me a while to get used to that one. After your transcript gets translated and evaluated, you're going to take a licensure exam, which is called the NCLEX. One exam for anywhere in the U.S. Okay, one exam for anywhere in the U.S. And then you must identify what state you want to get a job in. Remember, I said every state is different. So you're going to apply to that state in order to take the NCLEX. And you're going to need a working visa. But that's going to come from the person that the hospital that you contact or nursing home contact if you want to work. All right, so these are where most of the foreign graduates come from that are in the U.S. We have a lot of Filipinos. About 58% are Filipinos. Canada, some people come down from Canada, although who knows what's going to happen now with President Trump. Maybe we're not going to get Canada nurses. And we get some from Africa and some from other countries. Where do they? Yeah, 7%. So that's our foreign, that's our Puerto Rico, Virgin Islands, Guam. Those are those places that also have nursing programs. Yeah, they have to take the exam same way as everybody else. Top destination for where nurses who are foreign graduates come into. Look where the most applicants are. Pennsylvania, everybody loves Florida and Georgia. Everybody loves Texas. People also love the whole Western area. And everybody likes to go to Chicago. So that's why Illinois is really prevalent. Now, I live right here. This state right here is New Hampshire. That's where I live. And last week it snowed. When I talked to my husband, they had snow again. It's like, well, you better get rid of it because I'm coming home with nice weather. All right, how long is it going to take for you to apply? About 14 weeks for the required documents, your transcripts, your experience, your TOEFL goes in, all of those papers usually take about 14 weeks. Once all the papers are there, the processing is only about 2 weeks. Now, when you look at places like Australia or England or France, you're going to find out that this is very quick. Compared to the other countries, this is very, very fast. Yep. All right, so here's the IELTS. I compared them. The cost is about the same. They have passing rates that are different, but they score differently. And most of the times the US wants to see the TOEFL. This is not hard to pass. Do you think? It's not hard. Not hard. Right. So those are the websites that you can access the application. You could take the TOEFL right now if you wanted to. I mean, we don't care how old it is, as long as we know that you can pass these two English exams. Whatever. Now, what about the charge? This is for the whole application. How much? So someone wanted to know how much it's going to cost, right? That was one of the questions. So you got to take the TOEFL, right? And okay, the NCLEX exam, the actual exam, varies by state. It can be anywhere from $200 to $750. Now, guess what state charges you $750 to get a license? No, other side. California, $750. I saw that and I went, oh, wow. You can come to my state and it's only $200. You're going to have to get transcripts. Does the university charge students for transcripts, officials transcripts? Probably free, I would think, after graduation. Oh, department's organization. Yeah. So there may be a fee there. Now, in order to take the NCLEX, you take it on computer at a company called Pearson VUE. And they charge you just to sit in the seat about $350. Okay. Now, you're going to have to get your transcript translated. It's about $25 a page if it doesn't come in English. The application for CFGNS or True Merit is $485. I think that's high, but that's what it is. If you need an additional report because you don't know how many you're going to apply for, $125, and your visa is about $351. In the US, every nurse has to have a fingerprint, okay? And you have to have a background check. So if you have a felony in the US, you cannot be a nurse. Okay? Every nurse has to have fingerprints on board and a background check. So it doesn't include late fees, expedited fees. So how much is it going to cost altogether? Again, it depends upon the state. Anywhere from probably $1,000 to $2,000 it's going to cost to get a license, which maybe we can help with that. I'm going to talk about that in a minute. All right. You need to figure out what state you want to go to. You need to figure out what state you're going to go. Because as I said, each state has different requirements, but there's one exam nationwide. Now, the people who create the exam, very similar to Taiwan, TWNA creating the exam, we have a state board of nursing. The exam is computerized. You have 250 questions possible. But all you have to do is answer 75 questions correctly, and you're done. So I have had some of my students, I said to them, how many questions did you answer? And they said, 75. And I said, how long did it take you? And one of my male students, who was very cocky, oh, it only took me 25 minutes. Yeah, I said, well, you're lucky. And he was quite smart. On the other hand, you have 4 hours to do 250 questions. So you could sit there and do your nails and brush your hair. You don't have to rush. In the US, we have about 70% of all nurses pass first time. If you don't pass first time, you could take it a second time. You can even take it a third time if you wanted to. Right? And you can even take this in Taipei. They have an exam center in Taipei. You don't even have to leave Taiwan to take the NCLEX. Take it in Taipei. All the questions are multiple choice, but there may be some audio questions like heart sounds, lung sounds. There may be some visual questions Like, where would you expect to see pain from an appendicitis? Okay. And you're not going to point to the left, you're going to point to the right. That's where your appendix is, right? So you actually move the cursor. So there's the website about the NCLEX. They give you some sample questions. There are books that you can study with. There's plenty of resources to study, practice. So the registration process. You find out what state you want to get licensed in. You go to that state and you apply. And you give that state your money. Then you go to Pearson and you find a date that you want to take it and a place. And once these two come together, you have an authorization to test, ATT. And you bring that little form on the day that you requested, on the place that you requested, and you sit down and you take the exam. It's pretty easy. Pretty easy. All right. Where do you want to practice? These are the states with the greatest shortage in the next 10 years. Louisiana, Georgia, South Carolina, this is New Jersey, and the West Coast, Washington, Oregon, California, Idaho. Really big shortages. But you can find any place, any hospital in the US would be glad to have you. So find out what are you interested in? Do you like cold weather? If you like cold weather, you're going to go up here. If you like changing seasons, we have spring, summer, winter, fall. Everything is different. In my state, I say, wait one day if you don't like the weather, because it will change. Every day is a different day. Every day is a different day. If you like it hot, down in Florida, Louisiana, Alabama, Texas, it's really hot. If you like to see tornadoes, you're going to go right around here, right? Earthquakes, yeah, it's California. We had one the other day. You need to decide if you want to go into the city or into the country. Because the US has very bad public transportation. Only in the cities, yeah, you're going like this, right? In the cities, you will have metros. So New York has a metro, Boston has a metro, Philadelphia has a metro, Washington has a metro, California, you drive. Chicago has a metro. But other than that, you've got to drive, and there's not a lot of buses. Of course, there's Ubers everywhere, right? You can Uber anything, right? But you have to pay for them. Not that cheap. So do you want to live in the city, or do you want to live out in the country, or do you want to live where it's nice and warm all the time? Do you want to live where it's different and you've got a lot of possibilities? You got to decide. So here's a salary, the most recent salary I could find, 90,000. It's up to 90,000 now. Nurse practitioners, look at those nurse anesthetists. Wow, huh? They make a lot more than I did. And sorry, ladies, but educators are the lowest paid. Yeah, university too. Yeah, lowest paid. My daughter made more money than I did before I retired. Yeah, it was really sad. But we only worked 9 months, right? So I always had to be a nurse for the summer in the hospital. So where is the money the highest? Look at where the money is the highest. Why is the money highest over here? Why is the money highest? No, shortage. Shortage. These are the states with the biggest shortage. That's where the money is. The money is in the states with the biggest shortage. Yep. Alaska really short of nurses right now. It's going to be worse in Anchorage where their volcano blows up. But all right. Annual salary of different types of facilities. If you work for the government, it's a little bit higher. You work for the veterans hospitals, but you won't be eligible for a veterans hospital. Hospitals, higher than ambulatory, higher than long-term care. Look at the difference between long-term care and hospital nurses. And local and private, even lower. Now, one of the things that you have to talk about when you want to move is cost of living. Why does it cost so much to get a license in California? Why do they make more money? Because they have a higher cost of living. We call that COLA. For example, these are the first in the alphabet. In Alabama, you make $69,000, but I'm sorry, you make $61,000. It's actually equivalent to $69,000. So it's cheaper to live in Alabama than in California, where if you make $124,000, it's really the equivalent of $106,000. So that's the cost of living adjustment. And you can get this online. You can figure out what the COLA is for every state. So it's not apples and pineapples. It's oranges and grapes, just about, as far as salary. I think my pointer's dead. It's dead. It's dead. Okay. Nursing growth and the nursing shortages. So these are the states where expected to find a lot of shortages, 16 states. And you can see it's because people don't want to live there or the cost of living is so high. And that's the problem, cost of living. Okay, next slide, please. All right, now, what happens? You get to a hospital and let's say you go to Chicago and you say, oh, it's so cold here in the winter. They get a lot of snow in the winter. I want to go to Florida. Can you do that? Yes. We have something called the NLC. The NLC stands for Nursing License Compact. So the states in green will allow you to move from state to state without getting a new license for 3 months. You never have to take the exam again. Okay? You never have to take the exam again. So if you were in Illinois, which is not, let's say you're in Arizona, you're over in Arizona and you want to go to Florida, you just pack your things, take your Arizona license, go to the hospital in Florida, show them your license, and you can work there for 3 months. Oh, I don't like Florida. I've been to Disney World. Maybe I want to go to New Orleans in Louisiana. You take your license, pack up your things, go to a hospital in Louisiana, and you can work for 3 months. So we call that the compact. Now, California doesn't allow it. Oregon doesn't allow it. Nevada doesn't allow it. Pennsylvania doesn't allow it. The other ones are trying to allow it. This is a slow process. But you can come up to my state and we'll have you work for us for 3 months. So what we do is we have a lot of nurses who say, I want to be warm in the winter and warm in the summer. So in the summer, I will come up to New Hampshire, and in the winter, I'll go down to Florida. Yeah, and I go back and forth. with one license. With one license. Right? So we make it flexible. Make it flexible. All right, someone asked me about unions. Yes, there are unions in the US. But of the 3 million nurses, less than 10% are members of a union. Now, why is this? Well, the National Nurses United is the largest union, and there are union states. And I want you to look at these states. California is a union state. Washington, Oregon, all of those states that are not in the licensure compact. Okay? Massachusetts, New York, and Michigan. These are union states because there are a lot of union workers who are non-nurses also working in those states, right? So a union state tends to be unionized all around. Now, what does a union give you? A union says, you don't need to talk to your boss. We will talk to them for you. How come I need someone to talk to my boss? Can't I just talk to you? The union says, no. No, if you have a problem, you talk to us, we'll talk to your boss. So a union is someone who represents you to the management. Okay? You're losing your voice if you're a member of the union. Now, there is a fee for membership, and it's based on percentage of your pay. So if you make, let's say, $5,000 a month, the union will probably take $1,000. Oh yeah, you're paying for that service. You're paying for that service. Okay? Now, staffing ratios, there's no evidence that a union can get a better contract than staffing ratios. California has staffing ratios now, and they have a huge shortage. Union representative versus a union unit manager. So every unit has a representative that's paid by the union to do this job, as well as work as a nurse. So that's where your money is going to. And if you don't agree, if they don't agree, they can go on strike. Do you get paid if you go on strike? Do you get paid if you walk out of the hospital and said, I'm not working anymore, I'm on strike? Who pays for you? Maybe the union will give you some food. Maybe not. So unions, yes, you can find a union state. You can find a union hospital. It's your own personal philosophy. Unions, yes. The union represents a lot of the nurses in California. In Michigan. Michigan, because of all the cars. So Michigan is a big car producer. And car producers, workers who work with cars, are in unions. So the workers are in unions, their spouses in unions. That's a lot of it. All right, contacting an employer. So you think you want to come to the US, you've taken your TOEFL, you have gotten your transcripts, and now you've got to get a visa because you need a visa in order to get in the US. So find out what state, what kind of a facility, Google it, I know you're all good at that, and contact a facility and look for their human resources contact. All right? The human resource person will send you to their nurse recruiter. That's who you want to talk to, the nurse recruiter. Make sure you have a resume or a curriculum vitae that you can send them, and complete the application for employment. And now you can negotiate. here's where the money comes in. So they are going to offer you a base salary. Likely it's going to be based on your 2 years experience. Okay, so they're going to give you an amount. And you're going to say, okay, that's all they can offer you as far as salary. But how often will I become evaluated? Because every year you get an evaluation and you get an increase. Depending on how the hospital does, it may be anywhere between 1 and 5% of your salary. Okay, so that's your first bonus every year. If you're a good nurse, they may give you 4%. If you make a lot of mistakes, they may give you 0%. Now, so how often are you going to get evaluations? That's something you ask. What about differentials? Yes, we use a lot of bonuses for shift. If you work evenings or nights, you get a percentage more on top of your base salary. If you work in the OR, you get more. If you work in the ICU, you get a differential. If you work weekends, you get a differential. You get another bonus. If you work holidays, most nurses have to work at least 3 holidays a year. So anytime you work a holiday, you get more on top of that. So you're working night shift, let's say evening shift. Evening shift in the ICU on the weekend holidays. Whoa, you are making a lot of money that day. Yes, it's worth it to work that holiday night, evening, weekend. Yep. Now, you can negotiate for bonuses. You can get a sign-on bonus, and you can ask them, do you have any sign-on bonuses? There are some hospitals in the US now. There's one in California. I could not believe it. The sign-on bonus was 30 million NT dollars over 3 years. Yes, 30 million and 1 million US dollars over 3 years, just to sign on for 3 years. That's California. It's California, they're desperate. Now, they can sometimes pay for your housing. They can give you a bonus for your housing. They can give you a commitment bonus. Now, a commitment bonus says, if you are still here at this hospital in 1 year, we'll give you $20,000. Some hospitals are giving $20,000 every year for 3 years. It's a commitment bonus. You're committing to stay in that hospital. Now, they will also reimburse you your license fee. Remember that $750 you paid to go to California? Ask them if they will reimburse you for that license. Some hospitals will do that. New grads, they'll pay for your license. They may pay for educational expenses. We have some hospitals that are paying for people who have high loans, educational loans. They're paying those loans off. And some hospitals will pay for you to fly from Taiwan. That's kind of cool, right? So bonuses, yes, it depends on the hospital, but you have to ask when you call them. You have to ask. You have to be proactive. All right. When you ask them, you're going to also ask about benefits. How long is the orientation going to be? Some hospitals, it's 3 months. Some hospitals, it's 6 months. So you don't work 6 months. If you're going to work in the OR, it's probably going to be a year. Yep. Orientation means usually day shift. What about the schedule for orientation? Is it 8 hours or 12 hours? What do I get? Do I get full pay for orientation? Usually you do. So you do. You're going to ask about the shift flexibility. You know, the only shift they may have is night. Maybe you want to go to day. What are the possibilities? I can work day, nights. You have to ask for that. Do they have a paid time off? How much vacation will you get? Most nurses will get a week vacation the first week, the first year. My daughter's vacation comes a day every month. Every month she works, she gets another day vacation. And she can use that whenever she wants. How much sick leave do you get? Usually you get 7 days a year sick leave. Means if you're sick, you get paid. Do they have a retirement program? Do they offer reduced housing? Do they have parking? That's a big problem, especially in California and New York and Chicago. Do they pay for advanced education? Many hospitals will pay a part of your tuition if you want to go on and get another degree. Do they, and here's most important, what kind of health insurance? You will have to pay something for your health insurance. How much does the hospital pay? How much are you going to have to pay? And how soon will it start? You want it starting the first day that you work. And do they have health and wellness programs? Can you get a gym membership? Will they pay for your gym membership? Yeah. So there are a lot of things that hospitals will give you, but you have to ask for them. You have to ask them. Okay? So contacting an employer. When you contact an employer, you want to know, when are they going to offer you a job? Every nurse is going to have a physical exam by occupational health nurse. They want to know that you can lift. That's basically what they want. They want to know you could see. They do an eye exam and hear. And they want to know what immunizations you've got. Immunizations are required for hospital nurses. All right. Illegal questions. When they interview, can they not ask? It's illegal to know about your gender or your gender identity. They can't ask you. It's illegal to know about your race. They cannot ask you that question. They cannot ask you your religion. It's none of their business. They can't ask you your color. They can't ask you your ethnicity. They can't ask you where you were born. That's illegal. They cannot ask you your sex, your gender. They cannot ask you your orientation. They cannot ask you if you have any disabilities. Cannot ask you that. Can't ask you that. Yeah. They may know. They may know. But it's not a part of employment. They cannot ask you your citizenship status. They can't ask you your nation of origin. They cannot ask you if you've ever been in the military. They cannot ask a woman if she wants to get pregnant. Or are you pregnant? Or do you have children? That's illegal. Illegal. That's not required for the job. They cannot ask you. They cannot ask you if you need child care. That's illegal. They can't ask you, are you getting married? Are you married? What does your husband do? Not their business. Okay? Not their business. They cannot ask you your politics. They can't ask you if you've ever been arrested. They cannot ask you if you use drugs or alcohol. It's illegal. They cannot ask you about your health. They cannot ask you your height and weight. And can't ask you how old you are. No, they can't ask you if you have a mental illness. they better interview you better. Yeah, no, they can't ask you that. They can't ask you anything about an illness. It's not a requirement for the job. They can say to you, do you have any problems lifting patients? Lifting patients. And what's your answer? No. Your answer is, I use the appropriate equipment when I lift patients. Okay? Can they ask you, can you work the night shift? Do you have any problem working the night shift? I would rather not, because of my biological rhythm. I think better on days. So they have to ask you related to your ability to do and be a nurse, not any of your social or political values. Now, someone asked me about men in nursing. Yes, we are making great strides. When I graduated from nursing school, I think there was one man in my class of 20. It's not very good. It's only 5%. Now we're up to 12%. Look at last year. We were at 4 years ago, we were only at 9.4. Taiwan only got 4.4%. You've got a ways to catch up. Yeah, you got a ways to catch up. Now, if your salary's caught up, I think the men would figure out it's a good place, good thing to work. Got to get those salaries up. 40% of all our nurse anesthetists are men. It's a big specialty for men. They like that independence, that autonomy. Most males are in specialties with fast-paced environments. You'll find them in the ER, ICU, and trauma, but you'll also find them in psychiatry. There are a lot of men in psychiatry, which is, to me, very interesting. And we have even an organization. American Assembly for Men in Nursing was founded in 1971, so they've been around for a while. So yes, men in nursing is very popular. It's not unusual. Men are treated the same way that women are treated, except by male physicians, and then they're treated probably a little bit better. That's gender discrimination. All right, I'm going to leave you by saying something that Florence Nightingale said, my hero. Let us never consider ourselves as finished nurses. We must be learning all our lives. So, did I answer your question about bonuses? A lot of bonus, right? And now bonuses, hospitals are just giving away money. They're just amazing. But you got to ask. Got to ask about bonuses. So what other questions do you have? Anybody want to come to the U.S.? No? Have I changed anybody's mind? Have I made it easier for you to think about? Yeah? Faculty, what do you think? Yeah. 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 What kind of nurse would you be if you came to the U.S.? Mental health psychiatric? Yeah. So mental health psychiatric is very interesting because every psychiatric hospital has its own police department. And now to get into a psychiatric hospital, you have to go through a screening for weapons. So mental health facilities are probably safer than most hospitals in the US. Yeah. Yeah. So safety is generally not an issue in the US. Sometimes emergency rooms are. Yes. But we have many in hospitals. It doesn't take much to call a security guard in the hospital, or patients or visitors. Visitors are probably our worst problem than the patients. Well, they can't get in. Well, the hospital is closed at 8 o'clock, so they can't get in there, and the security guard is right there. So I can remember one case of someone bringing a gun in, and that was in an inner city. And that's the problem with inner city hospitals, especially Chicago. There's more people being killed in Chicago these days than Mr. Obama didn't do much for Chicago at all. Yeah, Chicago is not, I would not go to Chicago. I wouldn't even visit Chicago. I won't even fly through the airport in Chicago. Other question? What else can I answer? Yeah, I think I answered them all, didn't I? President Trump. So everybody knows that President Trump is a narcissist, right? Crazy. Well, he's not crazy. He's a narcissist. You know what a narcissist is, right? No? You have a name for narcissist in Taiwan? Yes. But, okay, so you want to talk politics, huh? Okay. So we have Democrats and we have Republicans, right? The Democrats want an even society. If I say bordering on communism, is that offensive? Even society. And Democrats like to give money away. Okay? Republicans like little government, little federal government. They like the states, all 50 of us, to do what we want to do. The Democrats want to control the states. So they take our tax money and they give it to whoever they want. What Trump is saying, I don't want to take your tax money and give it to everybody. I want you to keep it in your state. Okay? So in order to decrease the tax money coming into the government, he's saying, we don't need all these programs. And for many years, the Democrats have been adding people, adding employees, adding workers, adding programs, adding departments. And Trump is saying that is not what the state wants. So Trump is cutting the programs that are not important to the states. So for that reason, that's why he's doing some of those cuts, right? So we are going to see unemployment go up. But those people haven't been working that hard. They've just been sitting there in Washington, not doing much. So that's one thing. I mean, he does have a point there. I think we've become too fat in Washington. Call it too fat, too many employees in Washington. Now, as far as the tariffs, the U.S. has become what we call a service provider. We don't manufacture a lot of things now because it's cheaper overseas. And why is it cheaper overseas? Because overseas, the salaries are lower. Okay? So that means we're very reliant on overseas. Again, think about reliance. The Republicans want the reliance on the people in the states. The Democrats want reliance worldwide. So Trump is saying, if you're charging us for imports, we're going to charge you for imports to try to balance the service product economy. So if Taiwan pays more in imports, then maybe your salaries will go up. Okay? Our salaries are we're gonna have some inflation because we've been getting things too cheap. You've been sending us things that are cheaper than what we can make. So we're used to it. So we're going to be hurt with the taxes just as much as you are. But Trump is a businessman. And what do businesses do to survive? They change. They must change with the time. Hospitals have to change with the time. Our hospitals, a lot of them are closing. because they can't be changing so quickly. If you can't change, you're going to die. So a lot of our hospitals are dying. So they're consolidating. And Trump knows that. If you don't change, you're going to die. So yeah, he's crazy. He's a narcissist. You know, he's got a mental illness. Is he a smart businessman? Yeah. Yeah. And at least he doesn't have Alzheimer's like Biden. Now, Biden had Alzheimer's bad. They were hiding it all the time. So it's not going to be happy for the next couple of years, but it will be better in the long run. Take your medicine and you'll get better, right? Take your medicine and you'll get, see? You figured that one out. What other questions would you like to know about the U.S.? Full of answers about the U.S. Come visit. Come visit. Go to Disney World. Go to, what else have you heard? New York. Go to LA. LA is very, very busy. You don't want to get in the Uber in LA. Believe me, you'll be there for hours. All right, questions. What are the available channels or pathways for working abroad? I told you that, I think. Agency fees, exam cost, I went over that, right? Look at this list with me. Duration or time limit when working abroad? No, if you get a visa and you've got a green card, you can stay in the U.S. forever. Believe me, Trump is not going to kick nurses out of the U.S. He is not going to do that. Aging population, yep. Labor conditions, I talked about that. Do I support collective time off for nurses to protest the working conditions in nursing practice? I think there are better ways of doing that. And if you can afford time off to protest, go for it. What is the percent of male nurses? I told you that. I told you organizations or unions, told that. Short-term and mid-term career development. I think one of the things that you could consider if you are going to go for a master's is come to the U.S. for your master's degree. You have to take the NCLEX because you need a license. So you've got to do that. But you can come to the U.S. and do a master's degree and get your English, get really good English, right? And come back to Taiwan and you would have a great job, wouldn't you? Yeah, right? True. I told you about how to get licenses in Taiwan. Job opportunity available, any kind of job you want, any kind of job you want. Permanent residency, work visa. Difficult to practice nursing in the U.S. only if you're fussy, only if you want to work. You know, if you want to work in the OR, oh my God, every hospital's got an operating nurse job. If you want to work in the ICU and you've got experience in ICU, every hospital needs ICU nurses. Every hospital needs med-surg nurses. If you want to work in obstetrics, maternal child, probably not. One, we don't make as many babies in the U.S. anymore. And two, mothers go home within 24 hours. So, and nurses who like mother babies love those jobs. They take them forever. So that would be the only job I think probably couldn't get. If you're, yeah, go home. Vaginal delivery? Oh, go home. How many days? 1 month? No, we don't do the month thing. We don't do the month thing. You can go home in a day. We do too. That's why we have visiting nurses. Nurse will come to your house. Food? No, eat whatever you want. Just don't do drugs. That's what we tell them. Just don't do drugs. No drugs. Huh? Yeah, if they're not breastfeeding, who cares? You know? We have a pretty high breastfeeding rate. We have a really high breastfeeding rate. I don't know, like that's not my thing, but yeah, it's pretty high. More than 80? Probably up there. Probably up there, yeah. So drink a lot of water if you're, and we have special breastfeeding nurses, right? Yeah. And they'll come to your house too if you're having problems. So, and you can go back to work as soon as you want to. And if you're working on the home online, you can work whatever. Best timing to pursue a nurse career abroad, get your 2 years of experience after you graduate and go for it. Start now to work on your TOEFL, you know? Start thinking about when you're going to take that, and that'll be your first step. Okay? Yeah, English ability is going to be your first step. Oh, that's pretty good. What else? But do come visit, and just don't think of California as the United States, because we are more than California. Everybody says, I always ask people, well, where have you visited? Oh, California. Okay, where? Los Angeles. Like, well, that's like going to Taipei and saying, oh, I've been to Taiwan. Where'd you go? Taipei. Oh, well, that's not all of Taiwan, that's for sure. Yeah. Yeah, so come visit all around. Go to Washington, D.C. It's a great place. We have some history there. Philadelphia is a nice city. Philadelphia is a very growing city. New York, hi-how. Hi-how. New York City is very democratic, so some problems there. Philadelphia is nice. Baltimore is very nice. You want to go to a good hospital, Johns Hopkins. Any hospital in the Baltimore area is a very good hospital. Johns Hopkins has got a great nursing program, nursing masters and PhD. Baltimore, yeah, Baltimore. Yeah, very nice place. Very low crime. A great football team. You guys into football? No? Basketball? Oh, Boston, right? Celtics. Yeah. Boston is nice. I like Boston. They have better transportation in Boston. I live about an hour and a half from Boston. I live in the country. We have 3,000 people living in our town. We have one pharmacy, one bank, 2 pizza places, and a college. We have a little college. We have no McDonald's, no fried chicken, no Ubers, no, gotta have a car. Countryside. But we have a ski slope if you like to ski. Yeah, if you like to ski in the winter. If you like to hike in the summer. That's my little. That's why I love this campus, because it's in the country. And I can hear the birds in the morning. Can't hear the birds in New York or LA. Markets. And yeah, we have one little kind of like a PX market in town. Yeah. Yeah, if you want to come to the US, you can contact me. Sure. Sure. Yeah, come contact me. Yeah, anybody here knows. Did I answer all your questions? Yes? Okay. Now, I have more candy in this bag. And my suitcase is already very heavy. So I'm going to leave it in the back. Please take a piece of candy as you go. And thank you, Shishini, for being so nice.
Thank you, Professor Susan. And we give Prof again. So thank you. Yeah.